The music in the background is not mine's. The music in the background is not Serenity's. Biomarkers helping diagnose dementia according to the National Institution in Aging. Welcome to Serenity Alzheimer's Dementia Research. Biomarkers are measurable indicators of what is happening in the body. They are found in the blood, other body fluids, organs, and tissues. Some can be measured digitally. Biomarkers help doctors and researchers track health progresses and to help diagnose diseases and other health conditions, monitor responses to medications, and identify health risks in individuals. So, for example, say you had an elevated blood pressure, right? Your cholesterol levels are a biomarker for a heart attack risk, okay? That's one way to be checked. So, for research in clinics in your area, if you would like to participate to help find other biomarkers and to help diagnose diseases, what you could do is you could go and do clinic trials. Some pay certain fees, like some doctor's office already do it. You might know of that. Like if you have a certain type of um, health issues, like diabetes is a big one, cholesterol is another one, high blood pressure is another. And now they've been doing it for dementia as well. So if you're someone who is interested in doing trials, you can start off like with your doctor office or some clinic that's in your area. So biomarkers help scientists find new ways to treat and prevent dementia thanks to clinical trial volunteers. Diverse participation in clinical trials is essential for safety and effective treatments that apply to many people. Study participants are crucial participants in scientific breakthroughs. So we really, really need the help out there to find cures and preventions and to educate people. Okay? So please get out there and help. Are you able to help? Clinical trials need participants of all different ages, sex, races, and ethnicities. Okay? To ensure the study results apply to help as many people as possible. And and the treatments will be safe and effective for anyone who will use them. Okay? So we really, really need help. So to find a center in your area, you would go to alzheimers.gov/clinical trials #how can I find a clinical trial near me. But all of these links that can help you, I will have a copy of the transcript of this video posted in the comments. So everything that I'm saying to you, plus the links, will be in the Google Docs. You just click the document and you just use the links accordingly to help yourself, okay? Biomarker test types. You have the brain scan, the brain dementia scan, and there's so many other types of brain scans that allows the doctors and scientists to identify the different factors that can help diagnose Alzheimer's disease and related dementias. Okay, so doctors also use brain scans to find clues to tumors and other sources of damage, such as a stroke, that can help make a diagnosis. The brain scans that are normally used to diagnose dementia are a CT scan, an MRI, and a PET scan, which is known as a PET scan, okay? A CT scan is a computerized tomography scan. So in the in the CT scan, it is a type of scan that is an X-ray that uses radiation to make pictures of the brain and other parts of the body. Okay, so like a head CT scan scans how the signs of the shrinkage of the brain um, is going on, like the percentage which occurs in dementia and other possible diseases such as an infection in the blood. You can use a brain scan. They look at the size in certain brain regions to previous scans, like to do a comparison. They know if the person has a pacemaker, they won't be suitable for MRI because it's magnetic. Okay. So a magnetic resonance imaging, MRI, a doctor, that's why they ask all these different questions to know if you're qualified to be able to get an MRI, okay? So thank goodness for the other types of scans, okay? So you don't need to have like metals in your body or it will matter. Like if you have surgical clips, debris, or you won't be a candidate for it. So, like a CT scan, an MRI can show where the areas of the brain are shrinking. So, if a person can't use the MRI, they will use the CT scan, okay? So, thank goodness for another type of scan. And this looks to see how the brain has changed over time. Now, there's evidence that show contractions that may support a diagnosis of Alzheimer's disease and other neurodegenerative dementias, but they may not be um, indicative of a specific diagnosis. So, before diagnosing dementia, doctors often would do the MRI and look at the results to rule out other causes of memory issues, such as bleeding or fluid accumulating in the brain. Okay. So various types of MRIs are available as well to study aging and Alzheimer's, okay, and the long-term effects of drugs that a person may take for brain health. So now the PET scan, the PET scan is a positron emission tomography scan. Okay, so this looks at small amounts of radioactive substances called tracers to measure specific activities such as energy, exposure, or specific molecules in the brain, in different areas of the brain. A PET scan takes pictures of the brain and shows areas of normal and abnormal chemical activities. So this looks at the chemical activities of the brain, okay, to help diagnose dementia. So amyloid um, PET scan is for a diagnosing of dementia, okay? Because of when a person has amyloid in the brain, like amyloid plaques, that's what causes dementia, okay? So when you have this abnormal deposit of protein in the brain, which is called a beta amyloid, the higher the amyloid beta levels are in the brain, this is letting a person know that they have Alzheimer's, okay? So a positive amyloid scan means that your symptoms are due to Alzheimer's disease, um, and that you're most likely in the early stages. However, some people may have amyloid plaques and never develop the symptoms of Alzheimer's. So the doctors has to consider the findings and looking at other tests. So then they have the CSF, which is a cerebral spinal liquid biomarkers. With this one, This is like the clear fluid that encompasses the brain and the spinal line, giving assurance and coverage. It's like a protection. Um, so it would be right back up here, like in the neck area, going to the back. That's the cerebral spine. That's from the neck entering to the beginning of the back. Okay. So this fluid, you would gather this fluid, of course, by an injection using um, a syringe. So this is called a biopsy. Okay. And they're looking at the brain cells and the proteins. Okay, as an identifier and to analyze neurological issues. Okay. So doctors perform, or also they can perform a lumbar cut where they're cutting, or either they can just do a spinal tap. That's when you put in the needle into the neck. I know all about that. So, and it is no fun, and you can get paralyzed from it. So they instruct you not to move. There are blood tests, of course, to analyze the proteins in the brain and to see if a person has had a stroke. So, for illustration, it is presently convincible for researchers and a few specialists, um, subordinate on the state specific accessibility reflects on the U.S. Nourishment and Sedate Organization rule to arrange a blood test to degree levels of the beta amyloid. A few other comparative tests are an improvement. Still, the accessible of these demonstrative tests is restricted. They are more common in acquire about settings where researchers utilize blood biomarkers to ponder location, anticipation, and the impacts of potential medications. So you also have hereditary tests, genetic testings to check the body cells that are passed down from a person during birth. Okay. So and you can look at the person's DNA. So future biomarkers. We really need to find more biomarkers because we really want to narrow this dementia thing down and any other neurological brain disease down. So it's always good to come up with more biomarkers, more ways to test for neurological diseases. Okay. So advanced biomarkers during the past decade have led to exciting new findings. So researchers are always finding new ways to try to diagnose brain disorders, okay, um, and the progression of it, okay, and to find drugs that are promising to work. Always, always, always trying to find ways. So, with that being said, I will have this transcript in the comments section where you can just open the file. You can go back and read over it to help you. And there will be links that will help you find support. Okay. And it would be good if you would um, help be a biomarker so that we can get a cure to brain diseases and types of dementia. I hope this research has helped you. Please leave comments. Please share.